first I thought I pulled a muscle. It was just kind of like a stretching, kind of burning pain in the right side.
For college student Sarah Segner, the pain was a symptom of something far more serious than just a pulled muscle.
I have avascular necrosis. It's basically where the bone doesn't get enough blood supply.
As bone tissue died, the cartilage in her hip joints deteriorated badly. Such painful bone-on-bone contact generally affects older adults with osteoarthritis. In both cases, eventually, the solution is likely to be the same.
Once the patient has arthritis independent of age, then that's when we have to discuss hip replacement. Surgery should be seen as the last resort. In a nutshell, the hip replacement is you replace the socket bone, the bad socket cartilage, with a metal socket, and the femoral side, you put a stem that goes down the shaft.
Mayo Clinic orthopedic surgeon Rafael Sierra says statistics show the average age of hip replacement patients is getting younger. Among the factors behind the trend, the growing obesity epidemic. He says because our hips and knees support many times our body weight, lightening the load lowers our risk of needing joint surgery. Sometimes with young adults, the decision when to proceed with a hip replacement isn't quite as obvious as it was for Sarah. That's when Dr. Sierra says he and his patients have a very honest conversation about the possible risks and benefits.
The one thing we have to consider before offering a hip replacement is the durability and longevity of our implants.
Advances in high-tech ceramic and plastic materials should allow the replacement parts to last longer, hopefully meaning more time before the contact surfaces need to be replaced.
I'll be good for probably at least 20 years, which for me is really exciting.
Modern approaches to recovery and rehabilitation had Sarah on her feet the day after surgery and out of the hospital in 2 days. 3 weeks later, a slight limp is the only clue to the surgery that put her back on her feet. For Mayo Clinic, I'm Dennis Douda.